Well, let's do this. Hello, everybody. I'm Chris Stevens, and I have the distinct pleasure of being the founding co-director for the Inspired Leadership Initiative here at Notre Dame. As many of you know, it is a program that offers the opportunity for people who have finished their traditional careers to come to Notre Dame for a full academic year and to pursue an area of study of their choosing and engage with students, faculty as a mentor, with the overall goal of being inspired to be an even greater force for good. Partnering with the Alumni Association and ThinkND, our theme this semester is Transforming Lives and Lives Transformed, with the focus on three critical and timely topics: pursuing a second act, the intersection of spirituality and leadership, and solving societal problems. There is no one I can think of who's had a greater impact in transforming young lives than our guest today, Dr. Juliana Otieno. For 3 decades, Dr. Otieno dedicated her life to helping those in need in her Western Kenya. One of 16 children, as a girl, she had to walk 8 miles per day to school. Her determination to helping others led her to medical school, where she went on to become the CEO and the only pediatrician in Western Kenya's largest teaching and referral public hospital. She was instrumental in developing strategies to combat malaria, HIV, and other diseases prevalent in Western Kenya, resulting in, among other things, a reduction in the infant mortality rate there. Dr. Otieno retired and enrolled in Notre Dame's ILI program in 2019 in order to discern her next act on how she can be an even greater force for good. Returning to Kenya, in addition to being the senior lecturer at Uzima University Medical School, she founded the Rusalia Resource Foundation, named in honor of her mother, Rusalia. Its goal is to identify, inspire, mentor, and financially support high potential girls in Western Kenya. With the support of inspired leadership fellows from her cohort like Carrie Shine, this 501c3 is still in the formative stages. But Dr. Otieno has a vision that this program can transform and empower girls who will become the future leaders in her country and beyond. After a day celebrating International Women's Day, it is a pleasure to welcome our guest, Dr. Juliana Otieno. Juliana, welcome.
Thank you very much, Chris. I want to say good evening to other people and good afternoon to all of you. I am very happy and I feel honored to join you today. So thank you so much. And I hope we'll have a fruitful discussion.
Oh, I know we will. Juliana, you know, I think it would be really helpful. Maybe not a lot of people are familiar with the country of Kenya. Can you share with us a little bit about your country, please?
Thank you, Chris. Kenya is in East Africa, is bordering Uganda, South Sudan, Somali, and Tanzania. It's a lovely country with beautiful scenery. We have lovely coastal shores, lovely beaches. We also have one of the nice national parks for wild animals, Masai Mara and Nairobi National Park. You will see all the big 5 in half a minute or half a second. So it's really beautiful. The population is now about 53. Our population rate is growing, but it's 2.3 per annum. About 5 years ago, it was 3%. So that has really reduced. And we are 42 tribes in Kenya that speak different languages, but English is the common language that is taught in school. Now Swahili is the second national language. And then each tribe have their own languages which they speak. So if I speak my language, my next immediate neighbor may not understand what I'm talking about. Thank you.
So Juliana, your contributions in Western Kenya have been amazing and everlasting. I was hoping maybe you could share with our audience a little bit about your personal journey.
Thank you very much, Chris. I grew up in a large family, as you've heard. It was a family full of love, real hard work, and there was discipline, and above all, my parents had high faith, believe in God. So it was not just a matter of attending church, but also having evening prayers, the whole family. And that kind of gave us values that I have held up to now. So as my dad taught me, I remember this very well because my dad taught me how to cook the first meal. Our staple food, which is called ugali, is maize meal. You boil the water and you put the flour inside, and then you really cook with a stick. And it has to become like a dough, very hard. And it was my dad who taught me that. I think I still cherish that memory. My mom, of course, taught me house chores. And the most important teaching I got from her is doing gardening and then taking care of small kids. Because being the firstborn, I had to take care of those small kids. At 8 years old, I still also remember very well how my dad said we have to plant trees along our compound in the village. And we did plant trees with my father. And the instruction was none of the trees should dry up. So it meant Juliana was to take care, water the trees every day, make sure nothing touched the trees. And don't forget, I was going to school very early in the morning and then coming back very late in the evening, and there was no electricity. Unfortunately, up to now, there's no electricity in my village where I was born. And so I kept the trees, and the trees actually very few withered. I didn't tell my dad because if he had known, it would have been another thing. And I'm happy to say the trees we used later on to put up my parents' house, the roof, which was very good. So my life changed drastically when I joined high school at age 14 with the support of my community people. When I passed class 7 or elementary 7, I was invited to the national high school, which was quite expensive by then. My dad actually gave up. It's my mom who went around soliciting for funds from villagers. And lo and behold, they managed to get enough money, and I went to school. That was Limuru Girls. It's near Nairobi, our capital city. Very cold. In fact, those days in the 70s, I would say the temperature would be like South Bend. So for me, coming from a hot area around the lake in Western Kenya, that was a cultural shock for me. Two teachers kind of changed my life, made my life gave me a high stick to look up to. And that was my math teacher in my primary school. And they came and they said I had to achieve it. My father also had set very high goals for me, and I did not want to disappoint any of them. So when I joined medical school, I was actually married before I joined medical school. So that was very difficult. And I had 2 babies when I was in medical school. That was very tough, but I managed. And with the faith that I had in God and the hard work that was really instilled into me earlier on, it was manageable. Coming back, fast forward to I finished my medical school in 1985. Fast forward 1992, I met one of my great friends who is now there in Notre Dame, Dr. Bernard Narlin. He's currently the director of the X School of the Global Health. By then, he was working with the CDC in Kisumu at the field station where there were lots of research going on, and introduced me to research. And from there up to now, I'm still involved in lots of research. So my life kind of changed because I was able, not only economically, but also to meet other people. And actually, I remember my first journey to US was in 1993 because of one of the researchers, and it was amazing. And in 1995 is when I had saved some little money and I decided to give back to the community by identifying girls who had done well but didn't have funds to go to school. I remember one of the girls, I got her from early primary, class 6. Her father had died. The mother could not afford anything. So I took her in. She was staying with a relative. I was able to pay for her. She went through high school. She went up to college. And I thank God that she's now working. Fast forward to 2007, I was made the CEO of one of the largest hospitals in Western Kenya. It was really challenging as a woman in that position. I had a staff of about 1,600 permanent and 400 casual. That was tough work because men in Kenya think women should not be holding such positions. Then in 2018, I retired from public service. I'd worked in government public hospital for 34 years and never joined private. And I'm very happy and I thank God for my contribution. 2019, I was so lucky to have joined the ILI program at Notre Dame, introduced by the same friend of mine, Dr. Bernard Nalin. And that was a year of, wow, lots of new things. And I think we'll discuss more about it. I just want to say that at Notre Dame is when this idea of forming the foundation to support the girls, so that it was made official. It was initially my personal, it was me, myself doing it, and it was only me who knew about it. I wanted to reach out to people, to friends, and even to my family for the support. And I'm happy my family, my children are with me, and also a few other friends. So that is in brief, my life history. Thank you.
Thank you, Juliana. I want to talk about Rusalian a little bit, the foundation that you formed, but diseases in Western Kenya are particularly challenging. The climate change allows for more infestation of mosquitoes, and the NETS initiative, I understand, has really helped. Can you speak to this, and what are some of the other big issues there in Western Kenya?
Thank you, Chris, for that question. In fact, Western Kenya is known for all the bad diseases and bad things, including high mortality in children and women. We still have malaria. The malaria, because of the nets, has really reduced, but is still a major occurrence in outpatient for both children and pregnant women. We still have diarrhea because of the unsafe water and the environment that is not very safe. We have tuberculosis, which because of also the high HIV/AIDS rate, Western Kenya has the highest. Then the country figure is now about 4.4% prevalence rate for HIV/AIDS. And in Western Kenya, is still ranging between 6 to 9. So we are still having very high of that. The child mortality, as I've said, is very high, and maternal mortality. Mothers, women dying because of childbirth is still very high in this area. I've just mentioned a few diseases that are really terrible. Yes.
So for our audience, I know that the United Nations organization, along with the National Basketball Association and the Women's National Basketball Association, have been very, very active in trying to get support for the NETS program. They have an organization called Nothing But Nets, and it provides free nets to children and vulnerable women so that they don't get bitten by mosquitoes. Our own Ruth Riley, who graduated from here, is a spokesperson for it. If anybody's interested in that, just check out nothingbutnets.net. So there's disease, there's other challenges. Can you maybe speak to some of the challenges that are facing the girls that you'd like to be able to inspire and help?
Thank you so much. I think one of the main challenges facing the girl child is discrimination in education. And that tends to be cultural. It's really rooted in the cultures. It depends in which part of the country you come from. my part of country in Western Kenya, the girls were not supposed to go to school. It was the boys that were given the chances to go to school. We have girls busy doing other works, house chores, child labor. They have sexual abuse, other violence has really risen in the girl child. Of course, the boy child now is also facing all this, but the girl child is still very high. The cases of human trafficking, early marriage. There are some communities that girls get married as early as 9 years old. And it is not to young men, it is to old men, depending on how rich the man is. Culturally, it's acceptable in those communities, but some communities, we don't accept that. There's high rates of HIV, AIDS, and other sexually transmitted diseases because of the unsafe sex, the risky behavior, and also the rising drug abuse that is now rising. In the drug abuse, the boys are more affected, but the girls are just accompanying the boys as well. So the numbers are increasing. Then we have teenage pregnancies, very high in some parts of Kenya, and also, of course, with other related abortion problems. Abortion is not legalized in Kenya. There's peer pressure. And I think the latest problem that now we have is the social media influence, which is impacting, I don't know whether it's positive or negative, but sometimes it's detrimental. And then in some communities, there's the female genital mutilation that is going on. And it's acceptable in some communities, but I think the country has come up and has risen up that is not acceptable at all. So those are some of the challenges we have for the girl child.
So UNICEF did a study back in 2006 and determined that more than 30% of girls 9 to 18 are trafficked into prostitution and even more into child labor. Has there been any progress made since that time?
Yes, there has been. I think the government has come up with some laws. We now have the Sexual Offense Act. We have other laws that has been made to be quite, the penalty is very tough on these offenses. And also the Children's Department, the Child Social Welfare, and the advocacy groups, the civil society groups have come up to challenge this. And we think there is some headway being made. The sad thing is the parents are also involved in this child trafficking because of the money, the cash that is bringing. So that makes it a bit difficult. So sometimes it's done under the table, nobody knows about it. It only flares up when something goes on wrong, and that's when it comes up. But now the law is much stronger and is against that. And the punishment can be very, very, very serious.
So, Juliana, you became the only pediatrician and the CEO, woman CEO, of the largest public sector hospital there. Can you speak to maybe some of the accomplishments that you're most proud of that happened in the hospital while you were there?
Thank you, Chris. I think one of the achievements was being involved in research and actually made sure that the hospital environment was conducive to research in human beings who are sick in the hospital. And that brought in funds. So we were able to lobby one of the organizations, that's Malaria Vaccine Initiative, that was doing research on children's severe malaria with our research body, the KEMRI, Kenya Medical Research Institute. And actually they put for us the current children's hospital. And we named that hospital Obama Children's Hospital. By then, the former President Obama was a senator, and he came to open the center.
Wow.
So there was also improved care of the sick children by not just working alone, but mentoring the young doctors, the nurses, the medical students. And I'm happy to say that quite a number of doctors became pediatricians because of being involved with me. I was also able to nationally be able to formulate guidelines in children's care and more so in the HIV/AIDS care for children. HIV/AIDS was very bad from 90s up to 2010. ARVs were not available, or if they were very expensive. I've also been able to mentor young girls, not just the medical people, but other people. I remember one of my girls that I took to school, I met her in the ward. And she had come with her mother, very pathetic situation, very poor. And I was like, this girl is so sick, but she's so bright. I was touched by her. So I think I also used the hospital funds to support people in training. Without training people for further studies or even for on-job training, people will not refine their skills. So I think those are some of the achievements. Of course, the infrastructure goes. You will come and visit and see some buildings that I managed to put up with resources from friends and other people.
So 2 years ago, you retired and you found the Inspired Leadership Initiative and traveled halfway around the world to South Bend, Indiana. Can you tell us a little bit about your thoughts about your time here in the Inspired Leadership Initiative program?
Thank you. I want to say that thank God when I arrived in Indiana, the weather was good. Had it been cold, I would have frozen to death because I don't like cold weather. But being at Notre Dame was really an eye-opener, and it's something that I was expecting it, but not to such a great magnitude. The people that I met, the classes that I was attending, kind of changed my thinking. And the cohort that I was in were 15. They were just amazing people. And I thought I would come to relax a little in the US, but I ended up doing a lot more, and I'm happy that I did more because that's how the formalization of the Rosalia Resource Foundation was started. And it was because of attending one of the classes. We have international development class and then the inspiring designing your life. And I think it is just amazing. The people in Notre Dame, the reception that I received, even the undergrads. I'm so happy that because of my skin, occasionally you will be looked at twice, but majority of people just received me well, and my skin was not a problem at all. So I would say Notre Dame and the ILI program brought me higher than where I was. And I'm so happy that now I'm able to talk about it. It's really a program that is good. You don't just retire and resign. You continue thinking and doing things. And I think that is what was awakening to me.
Well, you've been able to go back to Kenya and as a senior guest lecturer at the University of Uzima Medical School, but you're pursuing your dream of helping girls achieve more with the Rosalia Foundation, and your website just went live today. So if anybody wants to check out the Rosalia website, it's Rusalia, RUSALIA.org. And I know that you're very, very excited about this, and I know that you've had some support from some of your fellow ILI fellows like Carrie Shine, but maybe tell us a little bit about where the foundation stands now.
Thank you so much. Rosalia Resource Foundation, as Chris had said, I named it after my late mom, she reached elementary 3, but my mom knew how to read and write, and she would read for us the Bible. So that was amazing. And I'm like, if my mom was not there, I would not have gone to high school. And because of the support I got, I just decided to formalize making sure the girls from disadvantaged families go to school. The foundation was registered in Kenya first in the year 2020, February. And then later in the year, it was registered in the US. And really, in the US, I have a wonderful team headed by Perry and the rest. They're very good. In Kenya too, I have a wonderful team. I'm also involved in doing mentorship. Our vision in Rosalia is not just to take the girls to school, but also to mentor them, to work with them, to make them strong. I've told you the challenges the girl child is facing. I forgot to tell you the girl child sometimes also still walks 8 miles the way I did, even in high school, to reach the school and go back home every day. And when she reaches home, there's still work to be done. There's no time for reading. So those are the challenges that makes girls not perform. So it's a matter of mentoring the girls. No matter what challenges you have, if you remain focused, if the girls remain strong, and they have somebody to work with them, they can achieve greater things.
Well, I know that Carrie Shine has been very, very helpful in setting up the 501c3. And I think Carrie's on the call. And Carrie, maybe you could provide a local perspective in terms of the structure. I know that a girl can be sponsored for $1,500 a year. Just tell us a little bit, maybe from your perspective, about where the organization stands.
Oh, well, thank you. It's an honor to be able to work on this organization. We're a new 501c3, but that notwithstanding, we've really, I think, come a bit of a ways. We have some wonderful donors, especially some people within our ILI cohort that have really been fabulous in terms of supporting us. And at this point, we are structured as an American organization specifically for the purpose of raising funds and doing whatever we can to support the Kenyan organization. And so our job is to develop and market and make people understand what a great project is happening in Kenya and recognize all of Juliana's good works. And then as funds are raised here, we bank over here in the US system. It allows us to be a little more transparent. And as funds are required for tuition, mentorship programs alike, we go ahead and wire funds over. So example, we have 7 girls actually enrolled right now in school. So we had the tuition bills come up. We were able to, in December, go ahead and wire funds. And then Juliana's team takes care of distributing what she needs to the different schools in Kenya. Same for the mentorship program, which she recently organized in December. And so we provide the funding. And so we're very grateful. This is a volunteer organization. Everything goes over to Kenya eventually. So we're very grateful for whatever support we can get. It's also, I'd also like to say that the money, the US dollar, goes very far in terms of providing support in Kenya. So as Chris mentioned, we can sponsor a young scholar for $1,500 a year, which would be shocking. You know, in the United States, it costs so much more to send a child to a boarding high school, but we can provide the child with that great of an opportunity for $1,500 a year. And we raise the other monies for just our general fund. And so that also goes to pay tuition, transport costs, books, and the like. And so we really do need, and that pays for all the mentorship programs and like. So we do need to have the general fund monies to be able to keep the rest of everything afloat. So that's the way it works.
Well, I committed to you that when you got the website up and live, that I would sponsor one of the girls. And so when we get off the call, I'll be good on that word.
Well, thank you very much.
Oh, my pleasure. So with that, why don't we transition a little bit to questions? I know that a wise person said that the mind can only absorb what the rear end can endure. So, and listen to me talk is not going to be what you want to do. We've got a couple of questions here from Salam, who is actually going to be in my esteemed class that I teach starting tomorrow. She's actually in the DC area right now. Her question is, her comment is, I have the exact same academic background as you, Juliana, and would love to involve any work that has to do with healthcare, poverty, and education. I was wondering if you plan on scaling the program, at least in Africa, so that it can eventually be done in places with poverty. Also, can we be provided with your information for potential mentorship in our endeavors back in Africa? Thank you. Juliana?
Yeah, I think, thank you. That is really wonderful. And really, you know, any help that is received will be very good. We now have the website. I think my details can be availed to the students. But I think the students is in Notre Dame, then they just need to visit Steve's class, Professor Steve Reffenberg, International Development. I'm so happy that last year, one of the class took up mentorship program as their DAT project. What is it? Division advisory team, a development advisory team class project. And they came up with a wonderful plan for mentorship, not just one time, but continuous mentorship over the years. And that is actually what we started using in December. I did mention that last year in December, we had our first mentorship program with the girls. The girls had been in school, out of school for 9 whole months. And we thought that was really timely. So this year as well, I'm so happy to say that another class is taking up Rosalia resource. And now we are trying to look at what next after high school. Is there anything? Are the girls ready to join school? How do we still continue supporting them to join colleges and universities so that once they finish, they may not be ready to join colleges? And remember, I've said that the girl child is so weighed down by so many things. So some of them still get accepted to universities and colleges, but for whatever reason, they may not go. So the student, I'm so happy for your question. And I think we'll connect with Chris and we can see what we can do.
Yes.
Splitting it into in other parts of Kenya or Africa, we are still small. So we are still just born. Let us crawl, then we will walk. And I think we will make it. Yes.
So another one of my amazing students, Megan Rogers, who's still here at Notre Dame, said, what will the mentorship program look like and who will the girls meet with?
The girls, one of the way we have structured the mentorship is not just the Rosalia scholars. It's not just the girls that are being sponsored by Rosalia Foundation. I'm also using one of the local schools to get girls so that they can also join and be made strong. So Rosalia is not just for providing mentorship for its own scholars, but is also bringing on board other students so that we work together. In Africa, in my community, you don't do things alone. You need somebody to work with. So that is what Rosalia has brought. And the mentorship program, what it involves is really talking, teaching, working with the girls, demonstrations. In fact, very soon the girls identified environmental management and they are going to have what we call kitchen gardens. Some of them are going to plant a few trees in their mother's backyard, and we will be visiting to see how those are going on. But we have a lot of health education. I've mentioned the problems the girl child has, and those are real. The HIV/AIDS, in fact, right now in Kenya, the new acquired HIV infections is by the teenage, and the girls are more affected than the boys.
Yeah. Boy.
Yeah, so the people they meet, I have a group. So I'm a pediatrician, so I'm able to take care of the kids, but I also have nurses. I have nurses who are adolescent expert and reproductive health expert. I have some people who are good in communication skills because sometimes these girls cannot communicate.
Yeah.
They have ideas, but they can't talk. They are too shy because of the exposure. So we have that. And I think we'll involve men But my mentors, the mentors right now are more of women and girls. And I hope the girls, once they're through, they'll be able to continue mentoring the other girls that are in the program.
Got it.
Thank you.
So I've only got 2 more questions here, so keep the questions coming if you have something on your mind. So Eileen, right here in South Bend, who was an ILI fellow with you, is kind of curious, is the Gates Foundation active in Kenya to your knowledge? Do you know?
Yes, Gates Foundation is very, very active in Kenya, is involved in malaria, is involved in HIV/AIDS work, and is an NGO. The headquarters is in Nairobi, the city, but they have spread out the wings. Unfortunately, we still follow what the partner says. So sometimes it may not be tailored for our country, but because the partners brought in the money, the Gates Foundation is also involved in vaccines, the immunizations, and they're supporting the local UNICEF with funds. And there's a lot of advocacy that the Gates Foundation is really advocating for. Advocacy in terms of educating the communities and more so the children and the women.
So Bill Miller, one of your fellow fellows, has a question. What can be done to change attitudes about child marriage and forced marriage? Are there programs that are effective in making a difference in those areas?
Thank you for that question. That's really a tall order because it is indoctrinated into some cultures. And unfortunately, the men don't want girls who have not undergone the rite. So that makes it very difficult. But I'm happy over the years, almost 10 years, there are some women who have become so loud advocating. They underwent the rite. Some of them did not undergo the female genital mutilation, but I'm also happy that the government, the political wing, is now putting in a voice. And with the political wing putting in a voice, we know there'll be some changes. We have a few strong women, educated. That's why girls must be educated. They have stood up. They have actually built some homes where they go and get these girls from the village and keep the girls in the homes because the circumcision is done at a certain period. So if you are able to get the girl away from the compound within that period, then she will have surpassed, she will have overgrown the circumcision. So some women are actually doing that. It's very rampant in Maasai, it's very rampant in northeastern Kenya, but I'm happy that more women, more men are also being involved, and the people are saying, can it be, if it has to be done? Now the other angle that has come up in the 2021 is, can it be done medically? Because girls do die from this procedure.
So I read an article actually this morning, Statista, which does all kinds of measurements in society, and it had the ranking of the highest percentage of elected officials being women. And there are 3 or 4 countries right there in Africa. How is it for women in elected positions in Kenya?
Thank you so much. We are not doing very well, but the women are being encouraged from this year to be elected. It's tough because Kenya during elections is a matter of, it's like going to war. There's no fair playing field, and it involves a lot of funds, and the men are the ones who have the purse. They're the ones who has the money. So the women who don't have enough money, they are not able to campaign as much, and even being nominated or elected by the office is like our constitution says 2/3 of the members of parliament should be women. We have not achieved that. We have not achieved that. So we are still waiting, but at least it's improving. But Rwanda is way up above us. Rwanda has done very well, and we are lagging behind. It's just because of there's no political will to have women. And I think Kenya is one country because of the many tribes, and most of the tribes look down upon the woman. So they think the woman cannot deliver. So why do you want to give her a high position? I think that is the greatest challenge.
What's your vision, Juliana, for the Rusalia Foundation in 5 years?
Thank you so much. I think, as I said, the baby is now crawling. We are soon going to walk, and my vision is to see it grow, and more girls will be supported. More girls will complete high school, and more girls must just join college or university, and the girls should give back to the community. We are not having a group that should forget to do good to others. And actually, we are also thinking of coming up with a volunteer program as part of our activities. And so that during the mentoring, the girls can actually go and clean up the local church. They can go and clean up the hospital. They can go and clean up the local market, some work in the community, and they do it voluntarily. We have not done right with our children. So that is something that needs to be instilled into them. So my vision is to see us grow, not just in terms of money. It's not money that is important. Of course, money is important, but that human person changing, being transformed, being inspired to be a better person. We are also instilling. In fact, one of the mentors I didn't mention is our local church pastor. We are just instilling that faith, that God, to anybody who can take it. Of course, people have different beliefs, but in Kenya, there's one person that is higher up, and that is God. So we are also instilling that faith, that feeling of I need to serve other people if I get blessed. And that is how I just felt when, God blessed me. I finished medical school and I became a doctor from a very small, tiny village that nobody knew. So that is my vision, is for us to grow, to involve more people. I'm very happy with the team in the US, even the team in Kenya. We are a small team. We are a team of 8 of us. And I believe that the numbers will grow so that the support will grow. Currently, we are for the next 5 years, the Rusalia Resource Foundation should we should be having 25 girls. But I want to say that sometimes, I've told Carrie this, that sometimes my heart overrules the head. So I get in more girls than the number that is required. So I hope I'll not be in trouble with the board if I get more numbers than what is required. Because believe you me, sometimes situations just arise that you can't just ignore. So even though we officially were saying in the next 5 years, we'll be having 25 girls that are fully sponsored and supported and mentored, but the number could be more. We will be reaching out to other girls so that the number may be, why not 50? Why not 100? If God is willing, if God is on our side, surely that is my wish, just to bring a change. If we have a pool from one village of about even 5 girls who have gone to school, you can imagine what a change they will bring.
Yeah.
The care they will bring to the family. There will be less of teenage pregnancy. There'll be less of abortions. There'll be less of illiteracy. And the women will be able to attend a hospital. And even when they get pregnant, they'll be able to take their children to the hospital early enough, because that's another problem that we have. So that's my vision, to transform the community, transform the village, and why not the Kenya country as a whole.
Love that. So Bill Schenner, fellow, is curious about, after a career in healthcare, 30 years in healthcare, you've kind of pivoted and your focus really now is education. Do you see the two as kind of interconnected?
Yes, thank you. Remember what I said earlier on, if it wasn't for the 2 teachers and those who are educationists, I would not have been transformed into what I am. So I believe education is really important. Even as a doctor, I believe I don't just treat people without giving them information. And when you're giving people information, you are educating them. So the two are kind of interrelated. So being in the medical school, I'm bringing up young people who will be able not just to diagnose and treat, but will be able to communicate and talk and explain to people, not just about the disease, but also prevention. Because we have lagged behind in prevention, we are just focused on treating and not preventing. So I think the two are interrelated, and that will still be my passion as I get older.
So you spent a year here during, and several months here during the most difficult time, I think, with COVID-19. How is Kenya dealing with COVID-19, and is it under control there? Or do you feel good about it?
I want to say that we thank God the COVID-19 disaster was not that much felt in Kenya. Many people died, but still, we thank God it wasn't that bad. We still have, and we are being told we are on the third wave. The numbers were going down in the month of December, January, but now from February, the numbers are going up again, and we are being told we are on the third wave. In fact, let me say that today I got my first vaccine for COVID-19. We are using, in Kenya, we are using the AstraZeneca, and the health workers are the ones that are being vaccinated first. So there's still the vaccine hesitancy, even in the health workers today in the field. It was in the open field. People were so few. And I felt like I should go to the wards and pull these young people who are so busy handling sick patients. But remember, that's not my job. So COVID-19, yes, it is a problem. Quite a number of doctors died, very senior doctors, some of them my teachers, and some of them our colleagues that we worked with. Some of them are our students that we mentored. Some of them are actually our families and relatives. So it has touched people. But the other social disruption it has done is, the school break. The school break was so long, so the teenage pregnancies just became almost 200,000%. So we are grappling with that. We have so many problems with that. The other challenge was just the social disruption of economic, and where for people to, there's a lot of urban migration in Kenya. So people leave the rural areas going to the city to look for jobs. Now, when there were no jobs, the factories were closed, everything was closed because work at home, these people who relied on working outside were not able to work. And it meant people either had to go back to the village and they were economically disadvantaged. But I want to say that the government did support some of the disadvantaged people economically with the finances. The government was actually advocating for safety precautions that were laid down by the WHO. And we are now happy that the vaccine has been brought, and we hope it will not just be for health workers. What we are told, the vaccine that is available currently now will be for 1 million people. With a population of 53, half of Kenya of 53 is children below 15 years. So we have about over 20 million who are above 15. So you can see that's just a drop in the ocean. Yeah.
Well, many of the girls that you talked about that you want to be able to inspire and mentor and help them become future leaders of Kenya. And one of the major issues that the country is dealing with is girl trafficking, human trafficking. And I just want to say that the Rosalia Foundation is born out of your work here at the Inspired Leadership Initiative and the commitment of friends and colleagues that you met here. And in a couple of weeks, we're going to have a chance to hear from 5 other fellows from your group that have started an organization to try to end human trafficking, and that includes in Africa as well. So our viewers or listeners can look for that. I think it's going to be April the 13th. Well, Juliana, I think I really kind of want to give you the final word here. Just maybe some final thoughts for our audience relative to your foundation, and take it away.
Thank you so much, Chris. I just want to say thank you so much. It was an honor to have been hosted by the prestigious Notre Dame University, and to have met so many lovely people, wonderful people. My parting shot, do what you can, support one another. It's not that you must know the person. You don't. All of us are human beings, and we all need basic needs. Let me just say that HIV/AIDS did terrorize. Let me use that word. It terrorized Kenya, and it terrorized more so the western part of Kenya, such that from the late 90s up to 2007, there were so many children who are orphaned, and they were heading these families, taking care of the families. So with any support that anybody has, whatever in your small village, your small area, reach out. It doesn't have to be financial. It could be advice. Think of one another. Climate change, if we don't act collectively, the only snow that we have in Kenya is on Mount Kenya. That Mount Kenya is the second, Kilimanjaro is the tallest, and then I think Mount Kenya is the second. And it's receding. It's receding because of climate change. So the climate change is affecting all of us. And because also then there'll be no food. And when there's no food, the environment is hostile. The people that suffer most is the women and the young children. Women started being girls, and the children, most of them are girls. So let us take care of our environment. Let us educate our girls wherever they are. And there are some of these cultural practices that if we have a bigger voice, advocacy, then can we check what UNICEF is doing? Can we join hands in what UNICEF is doing so that we can make a change? I think collectively, we can make a change and make a difference in people's lives. And with Rusalia, I think and I hope that the change will be visible, not just talked about, but visible, seen, that children or girls who have gone to school are making a difference. And the first difference I want to see the girls make is in their own life. If I've gone to school and I don't take care of myself, I'm not healthy, I'm not eating healthy, I'm not living better, my parents are not living in a better house, the environment around me is not good, then surely I've not been transformed.
Wow, Dr. Juliana Otieno, thank you so much for joining us today. So I'd also really like to thank our audience for tuning in, and I'd like to thank in particular Mary Scott and the Thinking D team, as well as our staff at the Inspired Leadership Initiative for all your efforts to make something like this happen with a special lady like Juliana. So please join us for our next session, March the 30th, for our next inspiring conversation with a Notre Dame grad, 82 grad, John Ebert. So John now currently owns 40 McDonald's franchises in West Virginia, and that kind of became his second act after he graduated from Notre Dame with an accounting degree and worked for one of the big eight, I think, at the time in Texas. But his philosophies and his leadership style with 2,000 employees plus an $100 million business are truly, truly, truly remarkable. And I've had a chance to get to know John very well as his lovely daughter, Grace, who's a sophomore here at Notre Dame. And it's going to be also interesting to hear about West Virginia, because West Virginia has become a model for most states about how to distribute and administer the vaccine throughout our country. So that's it. We hope that you'll enjoy our show today and that you will enjoy the next ones and stay with us for our series. Dr. Juliana Otieno, thank you very much.
Thank you so much. God bless you all. Thank you for listening to me. Thank you, Carrie. Yeah, thank you, Chris.
Thank you, everybody.